Happy Monday, everyone. It is so good to have you with us. Thank you for starting this week with Home with Isha Sesay. We have a fantastic lineup for you today. We're going to start in Ivory Coast with a focus on the Pasteur Institute, which, if you've been following the news closely, you know it's been making the headlines in recent weeks for the work they've been doing in Senegal on developing a rapid diagnostics test, which would be also at a very affordable price point. We're all waiting to see what happens on that front. It hasn't made it to market yet, but we're going to be speaking to someone from the Pasteur Institute in Ivory Coast to find out about their efforts, which in Ivory Coast are focused on diagnostics, what they're learning about the disease in Ivory Coast, and really this principal question of, is it less deadly in Africa? We're going to be exploring that on the show. And also, she led Liberia's fight against the coronavirus. She's, in fact, Africa's first democratically elected president. Ellen Johnson Sirleaf will be with us shortly to talk to us about lessons learned in battling Ebola back in 2014. And also to reflect on how to battle the pandemic today. Ellen Johnson Sirleaf will be with us shortly. Get your questions in. We have a jam-packed show. Let's get started. All right, then. Well, it is the start of a whole new week. So let's bring you up to speed on the numbers on the continent in terms of the spread of coronavirus and what we're seeing right now on this Monday. So let's put up some graphics. Let's go through the numbers for you. Let's start with the big picture and look at total confirmed cases. As you see there on your screen, 85,472 confirmed cases. When you look at the number of active cases, 49,752 of those are active. Look at the deaths. Look at the deaths recorded, 2,779. Let's drill down now for a regional view of what is happening on the continent. And in Northern Africa, Egypt remains the most impacted country. As you see there, over 12,000 cases, 12,229, with 630 recorded deaths. Also, I want you to keep an eye on Algeria, 7,201 cases there with 555 deaths. Let's move down to Central Africa. Take a look at Central Africa with me, where Cameroon is the most impacted country. And the country, as you know, continues to battle secessionist groups in the south. And of course, on the northern border, they continue to battle that Boko Haram threat. Confirmed cases in Cameroon, 3,105. Number of deaths, 140. We're also watching DRC for you, where they've gone past 1,000 cases. Confirmed cases, 1,455 in DRC. Recorded deaths, 61. Let's shift to West Africa. Ghana continues to lead the way in terms of case numbers in West Africa. Look at those numbers on the screen there for you, 5,735 deaths. Stand at 29. Now, President Nana Akufo-Addo of Ghana claims that Ghana leads the way in terms of tests per million people. That statement is being challenged right now. According to news agency Agence France-Presse, they say his claim is inaccurate and that South Africa, Djibouti, and Mauritius are ahead of Ghana in terms of testing. Keep an eye on Nigeria also. Keep an eye on Nigeria, where more details are emerging about a spike in deaths in northern Nigeria. We're going to be dealing with that story, tackling it this week here on Home with Isha Sesay. Total deaths in Nigeria currently, 5,959 deaths yet at this stage, 189 at last check. Sierra Leone, and my people, so I'm going to check them for you. More than 500 confirmed cases in Sierra Leone, 505, 32 deaths at last check. East Africa, let's look across to there. Sudan, the most impacted country in East Africa, confirmed cases, 2,591, recorded deaths, 105. Tanzania continues to be a major source of concern on the continent. If you've been watching the show, you know that there's great concern around the fact that the government has not released any new numbers since about April 29th. Also, we're telling you that since the weekend, John Magufuli, the president of Tanzania, appeared in a church and told congregants that numbers were on the decline and that God has answered their prayers. Not enough testing for us to actually be able to support that statement, but confirmed cases as of April 29th, which makes these numbers largely meaningless. But from April 29th, 509 in Tanzania, 21 deaths. Let's finish things up in the southern half of the continent, South Africa. South Africa continues to surge in terms of numbers. They are now past the 15,000 mark. You see on your screen 15,515 cases. Deaths 264. They lead the way in terms of most cases on the continent. South Africa, over 15,000 cases. According to the Independent Online, which is a local South African news media group, they say the South African army is now setting up 4 field hospitals to deal with what they anticipate will be a massive surge in cases. The peak in South Africa's outbreak expected in August. We're watching the entire continent and monitoring the case numbers and bringing you the very latest from across Africa. We want you to send in your thoughts as we tell these stories, as we shine a spotlight. We want to hear what you think, what stories you feel we should be concentrating on, how this pandemic is affecting you. Former Liberian President Ellen Johnson Sirleaf will be joining us shortly. So you still have time, everyone. Still got time to send in your questions and your thoughts. I'm going to be picking a few of those and I'm going to put those questions to Madam President. Get writing. Be sure to include where you're writing from. And as I said, I will pick a couple of those and share them with Madam President. So get writing. This show is about providing you with an opportunity to engage with our leaders. It's about you being part of the conversation. So please write in, send in your thoughts, send in your comments. We're extending the show by 30 minutes today. So I'm going to be with you for 90 minutes so that we can have enough time to reflect on the interview, get your comments, your feedback, and generally really digest what we get from President Sirleaf there. So send your comments during the interview and we're going to get to it afterwards. All right, moving on. Before then, the spread of COVID-19 across the world could certainly be slowed if we had more effective testing, more adequate testing. But that hasn't been what we've seen. Largely across the world, that testing has been inadequate and we haven't had people tested in the numbers that we would like. As a result, it's been hard to get a handle on the spread of coronavirus. All eyes now on Senegal. If you're on the continent, you're particularly focused on what's happening at the Pasteur Institute, where they are working with a British company, Malogic, to develop a rapid, low-cost test. How low? Well, according to what we got from Pasteur, and it's been widely reported, $1. They are looking at putting out a test for $1 that gets you the results in about 15 minutes. That test hasn't made it to market yet, but it is something that we are all looking towards to see how that changes our understanding of the disease and its movement through Africa. That work is being done in Senegal. We want to talk to someone out of Pasteur Institute in Ivory Coast, where they are leading the efforts in terms of diagnostics in that country. They're handling the samples as they come in. They've tested over 16,000 samples. I want to speak to one of their chief scientists now. Let's bring in epidemiologist Kwame Kwadjo. He runs the Echo Epidemiology Department at the Pasteur Institute in Abidjan. Kwame, welcome.
Thank you very much. Hello, Aisha.
Hello, it's so good to have you with us.
I'm also happy to be with you.
Let me start by asking you about how much of the population, or roughly what percentage of the population in Ivory Coast has been tested for coronavirus.
Thank you very much, Aisha, for inviting me for this meeting. I mean, the whole population of Ivory Coast is more than 22 million people. And Abidjan is around 6 million people. So when the first case occurred in March 11th, up to now, we have tested around 18,000 people. Of course, the definition of cases, we cannot test everybody because, I mean, in Africa, as you know, test is free. And I'm sure it's the same for all over the world. It's free, but it's the government who pays it. So actually what we decided, Pasteur Institute and the Ministry of Health, because actually Pasteur Institute depends on Ministry of Research. So what we decided was to have a case definition. Case definition is what is someone who comes to the hospitals who shows, symptoms which can be COVID-19. So up to now, it's around 18, 19,000 samples that Pasteur Institute of Cote d'Ivoire has had analyzed so far. And if we start from yesterday, for example, active cases is around 1,105. And we have, as we said, we have 27 people who passed away. And most of those people have, other diseases such as diabetes, high blood pressure, and so on.
So they have underlying conditions. Kwame, do you have a sense of where the hotspots are in the country?
In the country, actually, it's Abidjan and Abidjan district. Because, as I said, one of the first, we had the first case in March 11. One guy, Ivorian guy from Italy, was the first guy. And then when France was going to close the border, most Ivorian people, diaspora, most of them, they came to Abidjan. And then when they came, the government decided to put them in quarantine, but most of them, they did not accept. Maybe the spread of the disease started from that, but we tried. So the government took what we call state of emergency. The Abidjan and Abidjan district were cut from the other part of the country. So right now, all the COVID-19 cases are in Abidjan and around Abidjan. Like, as I said, when we had the first case, up to 21st April, we didn't have any active case in other cities except Abidjan and Abidjan district.
And Kwame, as you mentioned, you guys at Pasteur Institute have tested over 18,000 cases.
Yes.
When you look at those samples, what's the profile of the virus that's emerging? Is it different from what we're seeing in the West, in America, in Europe? Are you able to say at this stage?
At this stage, we cannot say. We cannot say anything at this stage. At this stage, what we can know or what we can say is that when we test those samples, we have COVID-19. But strain and so on, right now, it should be research. We should focus first on having diagnosis, because it's a hard time that we are facing. This morning, when I went to work, I just come back. You have like 2,000, 3,000 samples a day, and the government has centers. Right now in Abidjan, we have around 7-8 centers open. It's like people can come now free, to know the COVID-19 status. Mm-hmm. So as I said, we cannot collect sample from, for 5 million people in Abidjan. It's very costly. And it will be very difficult for our government.
Indeed. And Kwame, let me ask you this, though. At this stage, one thing that we can see, but don't necessarily understand, is why the number of deaths is so significantly lower in Africa. At this stage, what are the theories that are, as I should say,
like speculation.
The speculation. What are the speculations amongst scientific folks like yourself?
Okay, thank you very much, Isha. We can say maybe, we don't know, maybe because of vaccine, BCG, for example, maybe. Because in Africa, as you know, we don't, our mother, they don't take us to the hospital. I remember when I was a young boy in my village, even when my mom was pregnant, she had never been to the hospital. We are using, traditional medicine, herbs, and so on. So maybe those vaccine maybe can have an impact. Another thing is that maybe malaria. French researchers, they were saying that hydrochloroquine can be maybe a treatment. But in Africa, we know that, especially in Cote d'Ivoire, most of us, we had malaria. Even me during this COVID-19, I had malaria. I took my medicine. I took my malaria medicine. So what maybe we can say right at this stage, it will be very, very difficult to say something. So maybe after the outbreak, after the pandemic, we'll try maybe to find out why. Is it the same strain, the strain that we have in Cote d'Ivoire in Africa? You know, you said in your comment, when you take Northern Africa, white people, the number of deaths is quite different comparing to, you know, Western sub-Saharan Africa. So maybe something like that can be done later.
It is worth pointing out, Kwame, that in recent days, more clinical trials have been done, which further knock down the efficacy and certainly the safety of hydroxychloroquine. The largest the largest trial of its kind, recently published in the Journal of American Medical Association. But very quickly, and I've only got a couple of seconds, where are we in terms of that rapid, low-cost diagnostics test that your colleagues are working on in Senegal? When will it make it to market?
Actually, the one that Senegal is doing, actually at the Pasteur Institute of Abidjan, we are not doing rapid tests. What you should know is that, Pasteur Institute of Abidjan is government institute. It's not. We are in the network. Yeah,
absolutely. So do you have any information on?
We don't have I heard like you, but I know that our colleagues there are working with UK for a rapid test. But I'm not aware of that. Yeah.
Okay. Kwame, thank you so much for providing some insight into the state of testing there in Ivory Coast. Kwame Kwajo there with the Pasteur Institute of Ivory Coast. Thank you so much for your time.
Thank you very much, Aisha.
Thank you. Stay safe. All right, so we're getting a sense of amount of testing in Ivory Coast. They've done over 18,000 spots right now. Abidjan and Abidjan district. Right now, they don't have a sense, at least at the Pasteur Institute of Ivory Coast, as to whether the strain we're seeing in Africa is less virulent as what we've seen in Europe and America. But they continue to take a look at the situation there. They have over 2,000 cases there in Ivory Coast, and certainly over 24 deaths. I don't want to misspeak, so let me give you the latest number there. 2,109, 27 deaths, and over 1,000 of those cases. We'll continue to follow the situation for you there in Ivory Coast. Let's turn to Liberia now. Liberia, a country that is no stranger to dealing with infectious diseases. It was one of the countries hardest hit by the 2014 outbreak of Ebola. There are notable differences, obviously, between Ebola and coronavirus and the disease it causes, COVID-19. But there are obviously lessons that can also still be drawn from handling a mass outbreak of a disease. We know that in Liberia, there's been a ramp up in contact tracing, and movement restrictions were enforced pretty quickly in the case of coronavirus. We want to get the very latest on what the situation is there right now in country. So let's go to Monrovia. Journalist Bai Best is joining us from there. He's the managing director of the Liberian Observer Corporation newspaper. Bai, good to see you. Welcome.
Thank you again, Aisha. How are you?
I'm well, thank you. How are you?
Doing very well, thanks.
Good, good. What's the latest?
A crazy day. Well, we have out of 229 total confirmed cases so far, we have 84 of them that are active. So far, only 22 deaths. That's about 9.6%. And but we have a promising amount of recoveries. 123 of them. That's about 53 or more percent of the total number of confirmed cases. So I think it's a sign that we might be doing something good. We still have to kind of take stock of that and see what really is working. I took some shots today about just
let's show these,
public movements in town, and some people are not wearing masks. Some people are. Some people are out there on the sidewalk selling non-essential items and, doing a lot of business in that. Some people are doing their hair. So it is, it's hard to say what's working. I think what really is working that's very, very prevalent is the use of the hand washing buckets, and the restrictions of movements as per the curfew. Every major intersection in Montserrat County and across the country, there are police checkpoints. In some cases, the presidential guard is manning those checkpoints to make sure that people are not out there unnecessarily.
As we talk about restriction on movements, and thank you so much for sending those pictures of the situation in Monrovia. Seems fairly busy, kind of like the US, where people are out and about, despite efforts to try and restrain activity. I understand that there had been a great deal of debate around whether or not churches and mosques should be reopened as the country eased its restrictions. Where did they come out with that?
Okay, so at the very beginning, at the very onset of this state of emergency, the health minister came out with her own declaration with the acquiescence of the president and the joint security that churches and mosque services were to be suspended. And there was an uproar from the religious community, especially the churches, saying, you can't stop us because, this is the main time that we're supposed to be praying to God to wipe out this virus for us. And, science says, look, you know what, we have evidence and we have to do what we need to do by wisdom to clear this thing out. So when the president declared the state of emergency in his own right constitutionally, there were some, back and forth, negotiations with the religious community, the Islamic Council, the Liberia Council of Churches. But then just last week, the president came out with a statement saying that he would allow churches to reopen as of the 17th, which was yesterday, up to no more than 25% of their congregation numbers. Right. But then at that time, the number of cases in Liberia had passed 200. They were around 212 at that time. Right now, we're about 229. And the churches, especially the main Protestant churches, were saying, look, thanks, but no thanks. We are, with the number of cases still going up, it doesn't make sense for us to open now. So we'll just study the situation. And hopefully by the end of the month, we would come back and reevaluate our decision. Okay.
So to be clear, you mentioned the Protestant churches there, but were there services held with other faiths, other denominations?
Especially there are quite a few Pentecostal churches that held their services yesterday. About two major ones that I know that have congregations of over 1,000 on a normal Sunday were there, but of course they had to cut down to their 25%, and these are large edifices that had to space out their seats by 6 feet or more.
Mm-hmm. Yeah. Mm-hmm. Okay, so we'll continue to watch that. How has that decision been received by frontline healthcare workers?
Frontline healthcare workers were actually a bit upset because they know what they're dealing with. And they just felt that it didn't make sense. Now, I placed calls to officials at the Ministry of Health and including Liberia's chief medical officer. And interestingly, neither of them had, all the people I spoke with said, we have no comment as to who was actually advising the president to make this move regarding the opening of churches and mosques. So we're still trying to figure out who advised the president to do that.
All right. Bye, Best, Managing Director of the Liberian Observer Corporate Liberation newspaper. Always good to have you on the program. Thanks so much for bringing us the very latest. Stay safe.
Thanks again.
That's my boy.
All right. Well, joining us now is a giant of Africa. She's a global leader and known around the world for standing up for women and for the work she did in Liberia when they battled Ebola back in 2014. Former Liberian President Ellen Johnson Sirleaf is joining us. Not that she needs me to go through all that she's done, but I do want to remind everyone that she made history back in 2005 as the first female democratically elected president on the continent. It was a feat she accomplished twice with her re-election back in 2011. In that same year of her re-election, she was jointly awarded the prestigious Nobel Peace Prize alongside Lima Gabawi and Taukal Kwame for their non-violent struggle for the safety of women and for women's rights to full participation in peace-building work. As I mentioned, President Sirleaf led Liberia's fight against Ebola back in 2014. That was an outbreak which claimed the lives of over 11,000 people on the continent, and in Liberia alone took the lives of close to 5,000 people. Ellen Johnson Sirleaf has been very closely following this pandemic from her home in Monrovia, and she joins us from there now to share her insights and her sense of lessons learned from being at the helm as her country battled a deadly disease. Madam President, welcome.
Thank you, Asha. Good to be with you.
It's very good to have you with us. Thank you. Thank you so much for your time. Let me start by asking you your assessment of Liberia's response to COVID-19.
Liberia's response has been fairly good. I believe on the basis of the experience from Ebola, Liberian authorities have acted very quickly in trying to contain the transmission by putting in the right protocols, by being able to lock down and to start what was required, based upon the inadequacy of resources. As a result, I think the number of cases in Liberia are relatively low, well, as is the case perhaps in most of Africa. And so I believe that they are doing taking the necessary steps to be. We've been in lockdown and had 2 extensions already. There seem to be some opening up right now, some relaxation of the containment. I don't know how justified it is, but we do have a report that seems to say that transmission is not gaining at any fast pace. That would be overwhelmingly concerning to us, although we believe they should be very careful, how they open up, because it could lead to the virus picking up.
And you know all too well in terms of how quickly these things accelerate. Would you have taken the move to open up churches and mosques at this stage?
No, I think it would be well, since they have just put in a 2-week extension, that we ask the population to maintain the respect for staying for another 2 weeks. I think we needed to see what happens between now and the end of May before opening up. I can understand the anxiety on the part of people that miss going to churches, but there are other means whereby they could have arranged the preaching, and the church services without necessarily allowing people to break the rule about social distancing and then putting others at risk by opening a little bit too early.
One of the things that I have taken note of, and it's something you again saw during Ebola, is that not just in Liberia, across the continent, but let's focus on Liberia, when certain families, certain individuals have received a positive diagnosis for coronavirus, it's been rejected. There is a sense of stigma around it. There's a sense of people not willing to accept the threat posed by this disease. How should Liberian authorities be communicating? So how could they do it better? You were there once before and had to marshal the way a disease was communicated. How should that be done now?
I don't think there's enough communication to the public as regards the assessment, of the virus. Yes, there are reports. We do see formal reports coming from the authorities, coming from ECOWAS and other places. But the communication of explaining the virus a bit more, explaining the action that government has taken, and trying to say to people why it's necessary for them to be compliant with all of the protocols that have been established. So communication is always an important factor to build confidence, to ensure compliance. And that means the government, the leaders should be there taking the responsibility to communicate with the public, to bring to their attention where we are, how we have succeeded, what sort of facilities we have to be able to respond, to the disease. As I said, I think the response has been relatively good. But communication, I think, can also be sharpened, having media reports so that they can convey a little bit more detail about the repercussions, if the protocols are disobeyed, the transmission effect that would take place if we do not give enough time to ensure that we've got this virus under control. But I think we have a coordinating mechanism that's trying to respond to this. So there's always room for improvement.
Yeah, that's absolutely. You mentioned confidence and how at a time like this, confidence is everything. Confidence and trust, I would say, at a time like this between citizenry and their government, that really goes a long way towards assuring or certainly strengthening chances of success. The fact that at least 2 Liberian ministers have been infected with the virus, how much does that knock confidence? I can certainly say, speaking from someone who's sitting here in the US, having heard that President Trump had a number of people at the White House who were infected, it certainly raised questions about, here in America, it was said, if you can't keep it out of the White House, it makes you wonder about how things are moving forward at large. What's your take on that?
Well, Asha, I think it's just a clear indication that this virus is no respecter of person, that it can hit the rich and the poor, those in high positions and those in low positions. And that's a message not just for Liberia, that's a message for the world. Don't forget our Ebola experience. There was just 3 poor African countries. Mm-hmm. And perhaps the attention that we had anticipated was not up to the level that we would have wanted to see. And here you are today. COVID-19 has hit the world, just about every country. So that says to you that we ought to be mindful. And so if Liberian ministers were unfortunate to have contacted the virus, I think it just says we're all equal. They now know that they can attack a messenger as they can a minister.
Yeah. In terms of the continent, in terms of the African continent-wide response, in your view, what is working in terms of the response from leaders, and what needs strengthening? What needs to be tweaked? Again, going through your lens of having led Liberia through Ebola.
The African continent generally, perhaps in part of the Liberia Ebola experience or West Africa Ebola experience, have moved very quickly to put in the measures to contain the virus. The inadequacy of resources, perhaps, has not been equal in all countries. There are differentiation among countries. There are countries that are much better equipped with their national health system to respond quickly and effectively. There are others that are struggling to be able to put in place the measures to be able to treat the virus. But generally, Africa has relied, on its own limited capacity. The resilience that was demonstrated during Ebola is a resilience that is shown throughout Africa. The attempt to use natural resources, whether it's financial, or otherwise, I think is something that we see all over Africa, sometimes positively, sometimes not so. But Africa is making every effort to do the right thing in this virus. Now, where I think we need to be very careful is post-COVID-19. When the economic effect hits, it's going to be very disastrous, particularly for the poorer and the fragile countries of Africa. And that's where we must now start the preparation. We are still feeling the effect of Ebola in Liberia, the economic effect. I don't want to go through the details of what it means. And I just hope that our Liberian authorities, all African authorities, are paying more attention and having a level of preparedness for how we will mobilize the partnership, how you will get the resources, how you will get the cooperation of the public to start that long build of economic recovery.
What's the most important thing, or what would be the one action you would take if you were in charge right now when it comes to that economic recovery? What's the one action that could be taken right now to boost the chances of a faster recovery? Because we know the hit has happened. It's a question of how we recover. What's the one thing you would do now that you could do now?
Well, let's use the funding that is now being made available through bilateral and multilateral partners to fight COVID-19. Let's use that in a very transparent and effective manner. Use it in a manner in which you will start the preparation for economic recovery. That means not using it, making your allocation will focus on things like the small businesses, the farmers, the marketeers, those areas that will create the job, once you start the process of recovery. Of course, there are other things we have to be very careful of. We need debt relief, and I think there is an African initiative on this because we're going to have fiscal spaces are going to contract because revenues are going to fall. So just being prepared for the consequences and having the actions to the shocks that we will face, the responses, policy responses, we need to be ready for that. But we can start with COVID-19 and making sure the money we get now, either from debt relief or from other means of other sort of stimuli, that it will be used well and will lead to a productive endeavor.
China, with its numerous bilateral deals across the continent, has said that it would prefer, or in fact, it is saying that it will go forward and negotiate individually, bilaterally with each country, as opposed to Africa as a bloc when it comes to the question of suspension of interest and debt relief and such. Some have expressed some concern that China may use this moment as an opening to deepen its hold, if you will, or on the continent. How do you see it? Is that a source of concern for you? China's response to date saying it wants to bilaterally negotiate, and whether there's a sense of you have a concern that China will try and take advantage, because I think that's the principal concern that some analysts have.
I think there's always a danger in trying to go it alone on a bilateral basis, particularly in these circumstances that has hit the world where everyone is affected in all our countries in one way or the other. will feel the burden of this disease. This is a time for cooperative action, collaborative action. It is a time when all African countries must combine behind the measures that we are using strong advocacy for. The current chair of the African Union, President Ramaphosa, has appointed 3 eminent African professionals to lead the advocacy effort to talk about debt relief, to talk about rebuilding our industrial effort, our infrastructure. And we must all try to encourage the G20, which is to take the necessary step and leadership in this direction. All countries must stand behind them, in this common approach and this common call and this common action. Any deviation from that will only continue to divide us.
Back in 2014, when you were president of Liberia and facing Ebola, it was a very different world. You wrote that letter that has now become famous to U.S. President Barack Obama and galvanized U.S. support for Liberia. I want to read in part what you said to the BBC in comments. You said, I argued that an uncontrolled contagion, no matter where in the world and no matter how localized, is a threat to all of humanity. You said the world responded positively and did so boldly. A mass mobilization of resources led by the UN, the World Health Organization, and the US followed. We defeated it together. When I read those comments, I read them weeks ago when they were first made to the BBC, but as you made the point, we defeated it together. That was a very different world, and the man in the White House today has very different priorities. What does it mean for Liberia, for Africa, for the world to have a US not taking the lead in terms of helping shape a global response?
That was the message then, during Ebola. That is the message now. The world needs strong leadership to bring all countries together to fight a common enemy. It will not happen if we don't see leadership in all countries of the world. And it's not any one country. I think all countries, and we're accustomed to the major countries, the major democracies, taking the lead. And we're looking forward to that. Because if that doesn't happen, then it takes away from all the effort to bring about the cooperation and collaboration. And I hope that all those leaders will see the wisdom in coming together, because you see, that message was very strong. And if it were not for that, Ebola would not have been defeated. And here we are in a worse situation. We probably could have done the research, and we could have done the vaccines, and we could have done all what was necessary to be able to prepare for the epidemic that we now face today, because we did not come together. And we did come together finally under Ebola. But once Ebola ended and was solved, I think we all went back into our cocoons, and everyone seeking their own national interest. And here we are in the world facing something again. Let's hope that. Let's hope there's going to be a changed world.
Yeah, let's hope. But are you optimistic of a change? Maybe I'm just getting more pessimistic in my old age. But are you optimistic of a pivot?
Asha, I'm not pessimistic. Let's put it that way. I think there has to be a pivot. This experience that the world is going through, this respecter of nobody, respecter of no country, respecter of no religion or tribe, it's all encompassing. This has to bring some realization, some new consciousness that it is an interdependent world. We are intertwined by technology, by communication, by travel. the human spirit will always look for survival. And if we don't protect the poorest and the least among us, those who are the richest and the more advanced will feel the consequences, because you will not stop the viruses that know no borders, have no passports, and have no respect for any one person, group, organization, or country.
I can assume that the fact that you put your name to the call being made by UNAIDS for a people's vaccine alongside Macky Sall of Senegal, Gordon Brown, former British Prime Minister, and a host of other people. I can only assume that you've done that because you, or maybe let me ask, is it because you don't naturally believe that a pivot will occur on its own, that you felt that you have to, come together to put a pressure to ensure that a vaccine or any vaccine that is developed is available to everyone and not just the richest and the most powerful can dominate and take it for themselves? Talk to me about the people's vaccine and your concerns around vaccine nationalism, as it's being called.
Do I have confidence that if there are no strong advocacy, if there are no change in attitudes and policy, that vaccines will reach the poorer countries of the world? No, I don't have that confidence. And this is why we have to work harder. This is why we have to be stronger and unified in our effort as the poorer countries, as those that are trying to make sure that we demonstrate that a threat to one is a threat to all. Yes, I believe that we will see much more. We're calling for collaboration between our scientists, the scientists of the South and the scientists of the North, the disease control centers, to ensure that we can build those, either small ones in nations or regional and larger ones in continent. And we're hoping that that research work, whether it's vaccines or other approaches to be able to combat viruses and diseases, that will be available to all. I reminded people in another interview that malaria has killed more people in Africa, in West Africa, particularly, than either Ebola or COVID-19. And we haven't found a means to put together whether it's vaccines or other type of support to stop malaria, to eradicate malaria. We haven't found a way for prevention in other means like clean sanitation, like water and sanitation, which are good preventive measures. And so it just tells us that there's still more need for us to work together, to make stronger advocacy in Africa, to have a common approach and a common agenda in keeping with our Africa 2063.
Yeah. Well, Madam President, as you know, in terms of a response to COVID, Madagascar has been making headlines as their president, Rajoelina, has developed a so-called cure, COVID Organics, a herbal tonic, which to date hasn't been clinically trialed, and we don't have data to support his claims that it has preventive and curative properties. But a number of African countries have taken in shipments of this COVID Organics. Is that a move you support, African governments taking in this so-called cure that hasn't yet been tested, that we don't have data to support that it actually works and isn't harmful?
Well, let me first say to you that even in Liberia, we have people going back to traditional means of cure. They're looking for the herbs that work. You know, we all take ginger and all those things and put it in our teas at night, you know, to build our immune systems. Mm-hmm. And so you will expect that this will happen in all countries, many countries with different types of traditional methods are reverting to those methods. Well, I don't think that we can assume that this is going to be the cure. I think until something has been really tested by scientists who really know how to examine the effect of it and all the side effect that may occur if you don't get it right, and those methods rather than curing they end to make things worse. So I think one ought to be careful with that, but I'm not going to judge any country that's using its methods. Like I say, we're trying our own here in Liberia. We're just doing it, we hope, in a safe way.
But at least you're not shipping it around the world or to other African countries.
We don't have enough ourselves.
I want to read something else you wrote to the BBC and get from you and follow up with a question. You wrote this. You said fear drove people to run, to hide, to hoard, to protect their own, when the only solution is and remains based in the community. I know this. I made all of those missteps in 2014, and so did the world's responders. But we self-corrected, and we did it together. When it comes to the question of self-correction, and you've reflected on the missteps in 2014, what is the greatest lesson that you would share with authorities there in Liberia, with African leaders, with the world? What is the one singular lesson that you want to share with the world from your experiences of leading the response to an outbreak?
Our leaders in Liberia, elsewhere, should never forget that the most effective response comes from the ground level. It comes from those women, or those young people, or those trained people who are first responders, who are able to identify those who have the symptoms, to report them very quickly for action to be taken. Sometimes we get caught up in the bureaucracy and we form our coordinating mechanisms by ensuring that we have all high-powered personnel to come up with all kinds of theories and suggestions and approaches and policies. At the end of the day, what works are those nurses, those doctors, those paramedics who are out there taking the risks and doing what is necessary to keep people safe. That's our experience, and I think that holds true for now.
What do you make of the fact that countries who have done the most notable jobs, or the best jobs, let's just lay it out there, the countries that have done the best jobs in terms of responding to this scourge have been led by women? Jacinda Ardern in New Zealand, Angela Merkel in Germany, some of the Scandinavian countries. Why do you think that is?
Put simply, women make better leaders.
Amen.
Women are more committed, they're compassionate, equally effective, determined, open up to advice and collaboration. And women are not afraid of being wrong. And when making mistakes, taking corrective action and being able to face it. Women are not afraid of political fallouts or the next election and worried about whether to be elected. And that's why they can be focused, effective, and determined in battling any emergency. And the demonstration of it in these women that have already shown, I think, is one for the world. Listen, everyone, let us make sure we have more women leaders. Asha, that's what you're supporting. You have a foundation.
That's right.
We women, I have a center. I'm promoting the same thing. We all want to see greater number of women in leadership positions throughout public service throughout the world. It would be a better world.
And what have you been doing recently? I mean, how does the former president fill her days right now? And do you ever wish you? I mean, at a time like this, you wish you were back in the hot seat, leading the way.
Oh, I get anxious sometimes if I think something is not going right, or I think people have not recognized some of the things that have been done and the possibility that they can be continued and achieve the desired result. And I get very excited, I say, oh my God, I wish I were there. I would do this and I would do that. But never mind, I'm still happy to be where I am. I'm happy to do the things I do, to have the free time, to be free of the responsibility of whether you can meet the payroll next month. All those things. But I think it's good to have done something, to have left something behind, to know that it can be built upon and that your country can be better off if people hold together and see that leadership is a continuum. Country leadership needs to go from one phase to another, each one building upon the others and improving it.
Well, President Ellen Johnson Sirleaf, it has been such a pleasure having you on the show, and I just want to thank you for just being so generous with your time and your insights. Thank you so much, and I hope you won't mind if we bother you again in the weeks and months ahead to get your sense as to how things are doing.
Asha, thank you. Anytime, just call, we'll be there.
Thank you. Thank you, Madam President. Please be safe.
Thank you.
Thank you. Thank you again. Former Liberian President Ellen Johnson Sirleaf joining me for an in-depth conversation around the state of COVID-19 on the continent, specifically Liberia's handling of this outbreak, what the world could do better, the lessons learned from her time as president and leading Liberia's response to Ebola back in 2014. Lots of interesting points, and you have been writing in your droves. So we want to bring some of those now to you, and let's dissect it. I think for me, one of the big takeaways was just the sense of collaboration and the need for the world to come together, and her sense that we need that. That's the only way to overcome it. When I asked her about her takeaways around Liberia's handling of this outbreak, she made the point that she felt, the current administration has done a fairly good job, but stressed the need for communication and effective communication that could convey the threat, the risk to people from this virus. Let's bring up some of your comments. Let me read some of them with you and to you. I want to hear what you've been saying, what you make of it. Let me see. Going through them in real time. So bear with me as I go. The people from all over the place writing in, from Brussels, Belgium, we have them in. Lots of very kind comments about the interview. Jean Killen wrote this: all the president needs to do is make mask wearing mandatory in public, including him and every government official. If markets are open, then churches should be open as well, with everyone wearing a mask. This was something that I brought up with Madam President about this issue of churches and mosques being reopened in Liberia. She said it's not a move she would have made if she was in charge, not at this stage, as the country continues to ease off its restrictions. But we know that on Sunday that that was indeed what happened, that churches and mosques have been given the go-ahead to open up. The Protestant churches haven't, but a number of Pentecostal churches have, and mosques are open. Madam President saying that it's not something she would have done, and you see that comment from Jean there saying that if markets are open, then churches should be as well. Some other comments to bring you. Let's see. I'm going through them. There are so many comments, so bear with me in real time. Alim Idris Sesay says she's a breath of fresh air with her diplomatic insight and her experience in the post-Ebola recovery. Russ Lex says Africa needs strong leadership. We're able to speak to some African leaders about that. And there's some other comments that I want to bring you now that are here. We have well over 200 comments. So if you see me taking a minute, it's because I'm going through them, all of them. Many kind comments about the interview and people enjoying it. And lots of people saying, Asma Kamara James, yes, women make better leaders. People weigh in on that. I mean, it's a fact. When they looked at the data in terms of the countries that have had the most effective responses to this crisis, they have been led by women. So I want to hear more from you about that, and then whether you have a theory as to why that is. You heard Madam President say it's because women are consensus builders, they lead and they're not afraid of fallout. What do you think? Moss B. Jab says women are the most powerful people on the planet, whether you agree or not. I agree. You won't have any disagreement with me. You won't have any disagreement with me. Aminata Radiosel says, thank you, madam, for redefining the phrase African woman. You interrupted stereotype patterns, and for that we are grateful. She made history. I mean, it's as simple as that. She is Africa's first democratically elected female leader, and she was re-elected and won the Nobel Peace Prize alongside Lema Gabawi and Tawakkol Karman. She absolutely did. Let me see what else is here. Lots and lots of kind comments about how much you enjoyed the interview. Let's see. Stanley has a comment that what does she think of Dr. Kwau's position on African colonialism? Well, we'll have to put that to her after the fact and see what she thinks. June Jill Gordon says she juxtaposed the deadly effects of malaria and COVID. I think that she did. I think that was really important context to really just help us understand that as much as we talk about the threat of COVID-19, and that cannot be in any way minimized, we should also remember that malaria continues to kill unacceptable numbers of people in Africa, and we're yet to get a vaccine, and it has been a very long road towards getting that and effective treatments. And so I think it's also worth bearing in mind how long it's taken us and how we still haven't gotten there with malaria to help us understand that there's no guarantee we're going to get there with COVID-19 with a vaccine. We all want there to be a vaccine, but there's no guarantee that we're going to get one, or that more importantly, we're going to get one that works and is safe. And the other thing we can't forget is that even though we have COVID-19 as a scourge in the world, there are still a host of other diseases that are decimating populations and causing real anguish in Africa. So it's definitely something. It is definitely something to look at. Aladia Amara Kabe, following up on what I was saying about women, saying women have a natural instinct to care. That is why they make better leaders. More people talking about face masks. I'm scrolling through so many comments here. So many comments just with people just saying how much they enjoyed the conversation. Let me go. Olainka Michael Akinola, thank you for that comment. Nothing that pertains to the interview, so we're just going to leave it there. But M. Borka Jalabe says, Aisha, I was here in Liberia when Ebola struck. Madam Sirleaf, her leadership was outstanding. I can argue that level leadership is currently lacking across many countries and jurisdictions. Do you agree? What do you think? Respond to M. Borka Jalaba. Junior, let me know what you think. Do you think level leadership is currently lacking across countries and jurisdictions? Let me know. Let me read those comments and share those with you. Big Bobo Bar actually obviously doesn't agree because he says African leaders are corrupt. So there you have it. That's definitely one view that is in disagreement. Thomas Burrows wrote, people who have never led anything should not criticize leaders, especially on Facebook. You know, it is worth pointing out that, you know, there is, in an act of full transparency, that there are a lot of, not everyone is a fan of the former presidents. I mean, that's just being transparent. So some people, do not take her words to heart, and they weren't received well by some. Just showing some transparency there. So it's a mix of views. But generally speaking, a lot of people here in their comments saying that they appreciate her insights into what it was like in terms of leading Liberia during the Ebola outbreak. Looking through again to see Jean Killen says, amen, my Ellen, power to women. People saying much respect. Adejo Victor Davis says, laughing, Aisha and Mama Africa are now doing the gender thing. What would the gender thing be? Write and illuminate what you mean there. I think that's important. If you're saying that we're fighting for empowerment and for women to play a more active role in public life, absolutely we are, because women make better leaders. So absolutely doing that. Asma Kamara James, yes, women make better leadership. Roderick Com, I asked her about Madagascar. I asked about the Madagascar tonic and what she thought of it. And she was careful to stress that in Liberia that people are turning to herbal aids to help them through this moment. But she also said categorically that she didn't support Madagascar's tonic being administered to people without it having been tested and without it being proven that it actually works and that it's safe. And that continues to be something that is always, in our conversations here on Home with Isha Sesay. A lot of you write in about this Madagascar tonic and say that you support it. Roderick Com wrote, yes, I support the cure, but it isn't a cure. We don't have data to support us calling it a cure. There is no data to support that it actually works. So I think it's absolutely important that every day on the show you're going to hear me stress that. Because I think it's key that we ask for the science and the data to support any statements around any kind of treatment. Send me more thoughts. I want to hear what you think about this. And I want to hear where you stand on this conversation. We are going to bring you the bright side now. I'm going to come back to more comments in a minute, but I want to bring you the bright side because that was an intense conversation. We need to take a breath, reset, give you a chance to send more comments. Someone just asked whether I would consider running for leadership, running for office in Sierra Leone. It's Monday, Sheku Toure. Let's not go down that road on a Monday. Ask me maybe on a Friday, but for today, let's not go down that road. But thank you for even considering me as a worthy candidate. But before we get back to more comments, let's take a quick break and look at the bright side, because we do that every day here on Home with Isha Sesay. We take a look at an individual in the public eye and get their sense of how they're making sense of lockdowns and this new world we're living in. Today, our bright side is she's a breathtaking beauty and talent. See for yourself.
Hi guys, my name is Jocelyn Duma, actress, TV host and producer from Ghana. I'm currently in my car, but no, I'm not driving. It's parked. I'm parked in front of a supermarket. I'm about to jump out to get a few supplies for my house, which is something I've done quite a bit of during this period. I'm currently quarantined with about 11 people, which is great because I get to spend so much more time with my family, but it also means that I'm constantly running to the store to stock up on supplies and food stuff. So that's exactly what I'm about to do right now. Don't worry, I have my mask here, so I'll wear this before I get out of this car. But I'm very excited, guys, to be on the bright side with Isha Sesay tonight at 8:30 p.m. on Instagram Live. I'm going to tell you guys what I've done to keep my sanity, or not. I don't know if I still have my sanity, but let's find out, shall we? We're going to keep it very real, and it's at 8:30 p.m. on Instagram Live on the bright side with Isha Sesay with me, Jocelyn Duma. Can't wait.
The beautiful Jocelyn Duma there. She should be joining me at 1:30 on Instagram. So I hope you join me for that and get a sense of where she's drawing hope, what she thinks of this world we're in, and what she hopes to achieve when this is all over. How is she going to be a different person when this is all done? It's a very free-flowing, intimate conversation. I hope you'll join me on Instagram for that at 1:30. I want to get back to your comments. We've got a few more that have come in. In fact, we've got a lot that have come in. This one, Michael Fuller says, Aisha, you're following the COVID-19 situations in Sierra Leone. It's much different from other countries due to corruption and propaganda. The world should please follow closely Sierra Leone's situation. We are following all the countries on the continent to get a sense of. I'm getting some feedback on my audio. It's coming through, so I hope that's not troubling you. Apologies if you're getting that as well. We are following all countries in how they're handling the COVID-19 response. More comments are coming in. Jamila Quinn says, we need more women in leadership position. Women make better leaders. See, we struck a nerve there. Lots of you sending in comments. Again, tell me why. Why do you think that is? I want to hear your specific thoughts about what it is about women, and when they are in positions of leadership, what do we do differently that results in different outcomes? Adejo Victor David, going back to the Madagascar thing, because that's always a lively conversation here on Home with Isha Sesay, and it's one that's going to continue. Adejo Victor David said, Aisha, in Africa, we don't need data to know the potency of our herbs and roots. Let me push back on that emphatically. Yes, we do, because our lives matter. The lives of our people matter, and to protect those lives, we should make sure that the things that we ingest are safe. And it shouldn't be a trial and error to decide whether they actually are beneficial. I'm not just, oh, well, that person dropped dead, but hey, it's the price of, finding out whether it was effective. No, I do agree. We can keep an open mind. I do agree that herbs and different plants are very much in use on the continent and across the world. I'm in agreement with that. What I do strongly stand against is the is taking this so-called cure without any scientific data to back it up that it actually works, and people taking it, old people, children, pregnant women, people taking this thing without really knowing its impact and whether it could harm them. That I'm against. That I'm absolutely against. And when they have the data and they say it works and it's safe, I will be the first one to have that on the show and bring it to you. But for now, we don't have any data to support it. So let's just tread cautiously and carefully and slow down. That's where I stand on that. More comments coming in. Adama Maxwell, again, back to this question of female leadership. In terms of leadership, women are very passionate and consistent. You heard Madam President there, Ellen Johnson Sirleaf, again, making the point that just women, again, they listen more, they consider more. We've seen that. There's the data that shows that peace treaties, peace deals negotiated by women are more durable, that they last longer because they're more likely to take in different points of view. So there's greater consensus, greater buy-in. So it's not just supposition or feelings, or there's been a lot of study into what makes women different as leaders and the impact it has on their countries. Kadi Mansoure, women are compassionate, practical, and common. Again, I think that's true. That's absolutely true. We're toggling, I see from this interview, two main issues that are coming through. And it's about Madagascar cure and female leadership. George Kamara, referring to Madagascar, says, be mindful of drug interactions. That's absolutely true. Conta M. Conde says, I see many African leaders advocating for debt relief, but I'm against it because it kind of legitimizes mismanagement. What did they do with the money? People write in, let me hear your view on that statement. Conta M. Conde says, I see many African leaders advocating for debt relief, but I'm against it because it kind of legitimizes mismanagement. Do you agree? I certainly know that one of the things that you heard Madam President say there about Africa preparing for the recovery is that we need to make sure that there's a transparency and that the right allocations are made to support small farmers, small businesses, that's how we should be using this debt relief money. We should be investing it in the right places to strengthen our chances for recovery. John Gordon said, debt service relief from our development partners will help us a great deal, especially in Sierra Leone with the economic downturn. So very different view. Konta Mkonda is saying he's against it. John Gordon says it actually will be beneficial, especially in Sierra Leone with the economic downturn. To give you some perspective on the blow that COVID-19 will have on the continent, the expectation is that sub-Saharan Africa will go into recession for the first time in 25 years. So it's definitely something that we have to bear in mind, that the blow will be felt far and wide. This comment from Margaret Muiba, grateful for the discussion and Madam President sharing with us her thoughts. Well, Aisha, what do you think about the vaccine that they wish to test on our people? Strongly against that. Any kind of use of Africans as guinea pigs, coming in to test things without protocols, picking out Africa to test anything on us. I'm strongly, strenuously against that. Vaccine trials, as and when those occur, if they're going to do them globally, should occur globally. Everybody, as in those who choose to participate, should be given all the information. They should understand what is at stake, and nobody should be pressured. Nobody should be manipulated. And certainly there shouldn't be a sense that the rest of the world is being kept out of trials, and Africa is going to be the laboratory that people test vaccines on. That I'm very, 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 very strongly against, and that's where we need the WHO and all those overseers, all those vaccinologists, bioethicists, to make sure that the protocols, because there are protocols, that those protocols are strengthened and they are followed, that they're enforced, and that we hold our leaders accountable to ensure that that doesn't happen. Alim Idris Sesay says, our African society is very close and family friendly, more especially when it comes to our literacy rate. How can we help reshape the mindset of our people on social distance and post-COVID-19 response? The question of communication and how we communicate is absolutely critical. How we communicate these threats. I think that one of the things that we've heard effectively, or we've heard is working effectively, is translating the messaging into local languages, finding different mediums, whether it's radio, whether it's songs. And it's also something I said on the show last week, that when it comes to the question of taking away people's rituals that they would normally perform, for whether it's greetings, whether it's burial greetings, burial rituals, you have to give people a replacement. It's not enough just to say you can't do this to honor your dead. You can't wash them or be with the body in the case of Ebola. You have to give them another way to make people feel that they are honoring and they're fulfilling what they see as their duties. So I think these are the ways that we need to kind of engage. And we also need to have local leaders involved in shaping the message. It shouldn't be a top-down impact. It should be bottom-up. Civil society, local leaders, chiefs, religious leaders, all of these people have to be in play in shaping the message to communicate the threat to our communities when it comes to something like COVID-19. Going down, more comments. Emmanuel French. Aisha, from an honest standpoint, do you think the West will put out there any positive outcome regarding the potency and safety of the Madagascar cure, especially considering the fact it is made in Africa? Rather than me saying whether or not I think the West will do it, I know that Africa CDC has asked to have access to the data. I know that South Africa and Nigeria are also saying that they are going to run tests on it. So I'm not looking to the West to sign off on it. I'm asking that those countries that have capacity to do trials, to do tests, that those countries in Africa do those tests, so that we as Africans, in association with CDC, Africa CDC, led by John Nkengasong in Addis Ababa, have a handle on whether this thing works. So we can do this. We're not shipping it to Geneva. You don't have to ship it to Geneva. This comment from Maria Masakoy says, women manage homes effectively with or without adequate financial assistance. Let's give them a chance in governance. I'm sure they will make better leaders. Amen, sister. I mean, listen, I think we all have different strengths as men and women, and I think that they can be complementary, but it's absolutely true. Again, the data shows if you educate a woman, the impact on generations is much greater. Her children survive past, ages, critical ages where they might normally die from childhood diseases. Her children marry later. There's a better economic situation in the home. She invests in the home. We know the data. I mean, I can even speak from my own family, and my mother's education and the difference it's made in my life because she was educated. So yes, when you give women a chance, when you educate them, it makes a difference. When you educate them and when you allow them to take leadership positions, it makes a difference. More comments. Kadi Mansaray, collaboration is very important. We must pull together. Bindum Magona Tucker, women make better leaders because they can collaborate and compromise if need be. Roas Lex, Senegal has run the test and confirmed COVID organics is okay. So the thing with testing, right? It can't just be one place. That's great if that's indeed true. I haven't seen that anywhere else, but thank you for sharing that and we'll look into it. But Senegal has run the test and confirmed that COVID organics is good according to what you're saying. That needs to now go to Africa CDC. That needs to be verified. No scientific trial or test is done with just one party. You have to have several so that it has to be like peer reviewed, if you will, so that we know that it actually works. This comment from Adijo Victor David, African leaders are already competing for trials of the West. Citizens must resist the set of leaders who have failed to realize they can also think. Yeah, African leaders are already competing for trials of the West. So Adijo Victor David, I'm assuming you're talking about the vaccine and whether or not it's trialed in Africa. Again, I'm going to say any trial that's done should be done with full transparency, with effective protocols, and with the whole world participating. That's where I stand on that. So many amazing comments. Thank you so much for being part of this extended show and for sharing your thoughts and for just being part of the conversation. We do this show because I strongly believe that we need to have a platform that allows us to have a conversation, a dialogue, that unlike the TV experience, which is a great experience, in real time, though, on a platform like this, you can weigh in and there can be a give and take in real time, and that we have the flexibility to have this dialogue. So thank you for being with me on Home with Isha Sesay on this day. We have a lot more big name interviews in the works, so please check back with us. Keep an eye on our Facebook page. We will be definitely getting more leaders, more decision makers on, and I want you to again be part of that dialogue. I'm going to be moving over to Instagram now for the bright side with Jocelyn Dumas to get a sense of how she's handling the situation in Ghana and this lockdown and this strange world we're in. I'll be there in 8 minutes. I've been speaking for 90 minutes almost straight. So we're going to hit pause right now, reset, jump over to Instagram. That does it for us here with Home with Isha Sesay. Whether you've been watching on Facebook, Twitter, or YouTube, thank you. Thank you for being part of the conversation. I hope you'll join me tomorrow, same time, same place. We'll have the very latest on the pandemic in Africa, more great guests. Let's keep the conversation going. Huge thank you for all your time today. Thank you. I appreciate you. Please stay safe, everyone. Bye for now.